Hey there, it's Dr. Justin Marchegiani. Today's going to be a quick video on how to get in for your initial functional medicine consult as soon as possible. So number one, look on the homepage over at justinhealth.com. You're going to see schedule your consult. So really simply, you can go up here and schedule, or we can click on the work with Dr. Justin page in just a second. Two, at your consult, we're going to review number one, what's worked, what hasn't worked. We want to do more what has, less of what hasn't. Number two, we're going to review your diet and lifestyle, make any tweaks and adjustments there so we can optimize the foundational level of healing, which involves diet, sleeping, eating, hydration, movement, all of those really essential things to setting up a healing environment in your body. Number three, we're going to review your history, which is going to be accessed here by clicking on Become a Patient. Once you click there, you can put your email and your information in the box below, like so. Full name and email address, click submit, and you will get access to that. And then number three, we're going to start marching our way back to health. We're going to start getting better. So off the bat, click on the Work with Dr. J page again. So I mentioned the first three aspects of the new patient appointment. Number three was get the new patient paperwork by clicking here. Number four, we are going to review any old lab work you have, so feel free and fax and or email that over. And then number five, we're going to talk about what new labs we need to order so we can create a comprehensive functional medicine program that addresses the root cause of why you're feeling the way you're feeling. So if you're kind of on the fence and you're not quite sure if you can be helped, feel free and click here to schedule the complimentary consult. If you want to move faster, the better way to do it is actually just schedule a new patient consult right off the bat by clicking down here. We have some after-hour consults that are available as well on the website. Some of them are blurred out. We have that so we can keep kind of certain appointments open for patients that are emergency-based patients. So if we need to, you can always reach out down below and you can schedule an after hours by either clicking on the link here as well. So I'll just show you here. You'll see the complimentary consult button right down here. You'll see the after-hour consult where you can click either here or here. If you're a new patient, you want to click on the new patient, and then you can look at the actual new patient consult down here. So it brings you to the same place, just so you know. If you go back here, you're going to go look at the comp consult button. That just brings you right into the comp consult schedule already. And then if you click down here, this one brings you right down into the new patient consult. And if you want to get access to the after hours, we should have a link up here pretty soon to access it. But if not, you can go directly into the click here to make an appointment button and then click on the after hours consult down here below. So first things first, what you're going to do off the bat is get the new patient forms. Number two, you're going to schedule that appointment time. And then in the meantime, schedule for our health newsletter. You'll get access to all this great cutting edge information that will help provide you some diet and lifestyle advice and also give you information about what you should be doing to become a great patient so you can get the best results and compliance on your functional medicine program. So that's the first place to start and how to get moving forward. Next will be some of the most frequently asked questions that come about too. So you can go click on the FAQ page, which is located right here. You can click here. You can also find it up at the top under Work with Dr. J under FAQ and Clinic Policies. We can get it from both places. I'll click at the top. Once you're there, you can kind of get access to the most common questions. For the most part, if you're on the fence, the best way to get in is schedule a free or complimentary consult so I can figure out if you're a good fit for the kind of care that I provide. Number two, if you want to move faster, schedule that after hours or new patient consult. All the major stuff's right down here regarding communication. For instance, we do allow patients to email us because we're a busy clinic. We like to keep the answers under 1 to 2 sentences, ideally under 1 sentence, and ideally provide all the information up front to Dr. J, short and concise, so we don't have a back and forth dialogue. Anytime we have a back and forth dialogue of information, it's always better to schedule a new patient or schedule a troubleshoot consult if you're in between appointments so we can get that stuff answered. If it's an emergency, if it's not an emergency, write it down and hold off to your next appointment, or just write it out in an email that's very simple in a way we can answer it concisely. That's number one. So that's kind of has to do with some of the communication stuff. Regarding consultation, all the prices will be in here as well regarding prices. And then also regarding what kind of labs we typically do. Again, we have our own supplements that we formulated in the clinic to provide the highest level of quality. Again, what labs we typically do is we use a combination of BioHealth and Dutch and a couple different stool companies from DRG to GI Map to BioHealth to MDL or medical diagnostic laboratories for some of our infectious disease testing. And we also use BioHealth for our breath testing. And we also use some other labs, including Organic Acids by Genova, and we use some specific panels for blood tests such as Quest and primarily LabCorp for that. How long are consults? Typically run between 30 minutes to an hour. Again, pricing is right here as well, which always is subject to change. And again, how many tests we typically recommend? We'll start with anywhere between 1 to 4 lab tests off the bat. Again, I always tell patients that it's always better off doing something over nothing, because if we don't do nothing, if we don't do anything, right, we're stuck kind of either in limbo, which typically means we tend to slide backwards because gravity always tends to bring you back down to the ground. So we always want to do something, even if it's one lab test or even if it's just diet and lifestyle pieces, so we can start moving forward. So that's always number one. The cost is up here as well. We do not bill insurance directly. We'll provide super bills with ICD-10s and CPT codes, so you can submit it to your insurance. Some of the lab companies we do offer lab billing, where they'll actually facilitate billing with the insurance, and all of that's in the members area, which once you're a patient, you'll have access to that. So they will bill some of the lab insurances. Sometimes it's cheaper to pay via cash and just submit the bill directly to the insurance, because you get a much cheaper rate paying cash sometimes. So we don't ever accept insurance directly, but we do accept FHAs or medical health savings account, HSA, MRA, all those different types of accounts you can use where you can save money tax deferred for your health savings. Again, shipping and everything, all of our shipping policies are here, different programs. We don't typically do programs as a set program for thyroid or for gut. Everything is 100% customized with us. The various protocols are 100% customized. We do use certain products that you can read more about here. And if you want to see some of the tests and some of the labs and some of the supplements that we provide and we formulated, check out the Healthy Living Store. Everything is here by category, so you can see. So overall, that kind of gives you a good idea of how we're kind of move forward here. Number one, schedule your consult. 2, get your new patient paperwork. 3, you can feel free and just kind of get all your frequently asked questions answered ahead of time. And we typically answer a lot of these questions too during the consult and after. I just want to make sure you have all of the information at your fingertips, so these type of small questions don't interfere with your health improving. Thanks a lot. Again, this is Dr. J signing off. Have a great day.